The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Hello viewers, good evening. Welcome you all to today's episode of KIMSHealth Doctor Life. Myself, Pravasi. Health is wealth. We are taking tiny steps to build a better health. So, in this episode, we have taken the topic Coronary Artery Disease. To talk more about this topic, we have an efficient doctor with us. He is working in KIMSHealth Hospital, Al Hassan. He is consultant cardiologist. It's my pleasure to welcome Dr. Julian Johnny to the show. He is having 7 years post-cardiology experience. Doctor, welcome to the show. How are you, doctor?
I'm really fine. Thank you.
Can we move ahead to the discussion?
Yeah, definitely.
Regarding this topic, doctor, when we heard the term coronary artery diseases, like me, a common person like me doesn't know what is coronary artery disease. Can you please explain us what is it about?
Okay, definitely. I wanted this topic per se because coronary artery disease, though many people don't know what it is, I'll put it in simpler terms. Many people know the term angina. Many people know the term unstable angina. Many people know the term myocardial infarction, or commonly spoken as heart attacks. All this comes under coronary artery disease. So to begin with, I would just like to introduce the heart to you. Heart is an organ. It's like every organ is important, heart is also important. Heart pumps blood day in and day out. It works relentlessly for us. And heart pumps lots of blood, at least 5 liters per minute daily, into the various systems of the body. It carries the blood to various parts of the body, and it carries oxygenated blood full of nutrients. All the organs require nutrients and oxygen to work, like the brain, like the limbs, like the bones, joints, liver. All these organs require blood, pure blood, oxygenated blood, and nutrients to work. Similarly, heart also requires oxygen and blood to work. The blood vessels supplying the heart are known as coronaries, and any disease of the coronaries is known as the coronary artery disease. So any blockage in the coronary arteries, either because of fat, lipid, or blood clot, comes under the spectrum of coronary artery disease. I think it's clear.
Yeah. So what is the difference between coronary artery disease and heart attack?
Okay. This is a broad term. Coronary artery disease is a big, broad term. In that, a subset is known as heart attack or myocardial infarction. What we call myocardial infarction, and what the common people call as heart attack. Here what happens, the coronary blood vessel, which I mentioned earlier, is suddenly blocked by a clot, and the heart is deprived of the blood, and heart fails to function. The other word, as I said, is chronic stable angina. There the coronary blood vessel is deposited with lipid and fat, and slowly this increases, the block increases, and in the beginning we may not be able to find any symptoms, but as the block increases, when we do some exercise, we will experience some sort of chest pain or chest discomfort. This is what is known as chronic stable angina. So we have chronic stable angina and myocardial infarction, and adding these two, it forms coronary artery disease.
Okay. So if a person is having a coronary artery diseases, how it will affect our body?
So you can say, if I am having, or some person is having coronary artery disease, to begin with, I would like to just relate to you like a story. Like a man, routinely we are all from various parts of the country, and we are working here. We are doing our routine jobs like climbing stairs, walking. We are moving from one office to the other. While moving or walking, when we are not able to do our routine activities, that is, we are having some sort of breathing difficulty or some sort of chest discomfort while doing some activity, then we should focus ourselves that some problem is there with our coronaries. And the first term which I would like to put forward is the term chronic stable angina. Here we are not able to do our routine activities because our heart vessels are blocked, and they are not blocked completely, they are just blocked partially. That's why when we are sitting at rest, we are not having any symptoms, but when we are doing some work, or when we are trying to put some load to the heart, we have symptoms. Now in heart attack, it's a different story. We may not have any symptoms before, absolutely normal, but suddenly one fine day, when we are doing nothing or when we are doing some exercise, suddenly we have intense chest pain. That is because the blood vessel is suddenly blocked by a clot. 100% block. We'll collapse there because the heart is not functioning. That's a heart attack.
Doctor, regarding this one, a coronary artery, you are telling that if we are doing some exercise or if we are climbing a stairs, we may feel breathing difficulty. So that and all indicates a sign that we are having some health issues. Am I right? So can you please tell what are other symptoms that
are associated?
Yeah, associated.
We all have a routine activity pattern, like we are doing routine works, we are doing kitchen chores, we are doing office work, and these are all routine activities. We are doing it daily. One fine day we are not able to do our routine activities. That is the point, that is the time when we have to say we are having difficulty. Because if I am a person, I'm a usual exercise, I do usual exercise, but if I am asked to run like Usain Bolt, I will not be able to do that. I will have intense breathing difficulty, or some things I am not accustomed to do. That doesn't mean that I have heart disease. But my routine activity, today I run, every day I run 5 kilometers, but today I am not able to run. I am having some problem here, some congestion here. So that tells you, that's a warning sign. Don't stress too much. That is a time when we have to see that whether we have a coronary artery disease or not. Now, as you said, the other symptoms, it's not only the pain, excessive breathing difficulty or shortness of breath while doing some minor activities, just like by making a bed or making small dishes or just by playing. Just minor plays will bring you symptoms, shortness of breath. Sometimes you may feel giddiness, sometimes we feel visual blackout. By doing some few small works, that indicates that there is some problem with your heart.
If we are having these symptoms, as you told earlier, what should we do immediately?
So as I described earlier, if you are having few symptoms pertaining to the chest, you are not able to say what it is. Some sort of heaviness, or some people say gas-like symptoms. This pain may sometimes radiate to the inner aspect of your arm, or it may go to the underneath of the jaw, or it may go up to the stomach. So people say that I am having some gas. If it doesn't get relieved in a short while, you should get help. Get someone in your house to take you to the doctor. Kindly not go yourself. You may injure yourself and injure others. So take someone along with you and go to the doctor, and the doctor will do a series of tests, will examine you, will do a series of tests, and then will come to a conclusion. And some countries have a national number. If anyone has chest pain at home, at workplace, if you have no people around you, in Bahrain, we can always use a service call number 999, and emergency ambulance will rush to you, take you to the nearest hospital where there is cardiac support. So be free to call. Never be apprehensive and stay saying that it might be a minor complaint, it will all get resolved in a course of time. Don't risk your life.
Doctor, regarding this one, when the viewers hear all these questions, they will be having surely in their mind, because most of them will be having this breathing difficulty one or other day when we are doing some routine work. So can you please suggest some medical checkup to maintain a healthy heart?
So we are all working population, and age groups 35 to 45 is an ideal age group for screening for cardiovascular disorders. And what I routinely recommend is that at least at the age of 35 or 45 you should attend a clinic, and they will be checking your various parameters, like they will be checking whether you have hypertension by checking your BP and checking your pulse rate, checking your body weight. You should have ideal body weight, and after this they will be doing some few checkups, like they may be doing an ECG. ECG gives you a clue of what is your electrical activity happening in the heart. Any form of injury will be noted in the ECG. And another test that they usually do is the chest X-ray. Chest X-ray, if you have any sort of chest pain, they will be routinely doing the chest X-ray to rule out other cardiac conditions. Then they may do a fasting lipid profile, a cholesterol panel, and they'll be checking your sugars, your fasting blood sugar and your blood sugars after 2 hours of meal. Then they'll be doing something called HbA1c, which is a 3-month average blood sugar, and they may also sometimes check your uric acid levels. If uric acid is high, it shows that you may have a heart disease, or you may have something called metabolic syndrome. And they may also check your vitamin D levels. Low vitamin D is prone to a stroke or a heart attack. There are various studies telling that. Then they might check your creatinine, seeing your kidney function, a urine routine. All these are minor steps, minor tests that will help you to screen for heart disease. Then we go to level 2 tests. Level 2 tests are, if any of these tests are abnormal, we may go for tests like echocardiogram or a treadmill test. Echocardiogram is a scanning of the heart. It just tells you how your heart moves, the function of the heart, the pumping function of the heart, and it tells how your valves are working. It tells whether you have had a heart attack before, like a silent one. And a TMT is to diagnose new blocks in the heart. A TMT is nothing but a treadmill test. You are made to walk on a belt and heart is given a load. That is, a load means it is made to walk in a particular speed. The speed will be increasing every 3 minutes plus the incline. And each time your ECG will be taken and you will be asked for symptoms. If you develop any symptoms at that time, it will be supervised. It will be supervised by the technician and the doctor. And if you develop any symptoms or any variation in the ECG, it suggests that you have a block. Next is the level 3 of investigations. That is, if there is a variation in the echo or TMT. Next level of investigation is the coronary angiogram or CT angiogram. We are directly injecting a dye into the heart, and this goes into the coronary blood vessels, and you and me can see the block live.
Can you please also tell us about the investigation called troponin? I have heard the word, but I'm not sure what is it about. Can you please explain?
So earlier you told me that sometimes you may develop chest pain, and you call 999, and the ambulance comes to you, and you are taken in the ambulance to the hospital, and you reach the hospital. All chest pains are not heart attacks, and sometimes it's very difficult. Some heart attacks don't even have chest pain. So the doctor again examines you, checks your BP, pulse, and auscultates you, and then he will do the ECG, and then he will do, if sometimes there may not be a variation in the ECG. In the first stage or the initial stage of the heart attack, you may not be finding any changes in the ECG. And so what we do is that we do a blood test called troponin. So this test begins, it shows abnormal values if it's a true heart attack, and it begins to show abnormal values within 2 hours. So ECG, troponin, and X-ray are the first few investigations that help to diagnose heart attacks.
And one more doubt, doctor. I have heard about silent attack. Like once in a morning, the person will not be there. He may not be having any symptoms or any prevailing condition. He'll be normal and he'll be sleeping. But when the morning comes, we'll be hearing a sad news. So what is the cause of that? How we can
catch
that?
them?
Yeah.
Silent attacks, like you can say that, as I told you earlier, you may not be finding any variation in the ECG, or he may not be having any symptoms before. So that is a very, very sad situation. 10% of the cases of the heart attacks are like that. And so the main idea behind is that the screening is very important. At the age of 35 to 45, we try to find out as I told you, we'll be doing a treadmill, or we may doing an echo, an ECG, an X-ray. Somewhere we may get a clue that this patient may go in for a silent attack or a heart attack. So actually we should catch these people really very young. So catch the mangoes before they are ripe. We say that, no? So that is one way of catching these silent attacks earlier.
So can you please suggest some healthy lifestyle that everyone can follow so that they can be catched up earlier, or we can prevent from happening all these conditions?
One important thing I would like to stress upon is they should have a proper screening, and we are all here in Bahrain for work, and we are all in Bahrain for work, and we have very less time for exercise, and we should see to it that we do some sort of exercise every day, whether it be in the morning, afternoon or night. Whenever you are free, you are supposed to do exercise at least 30 minutes in a day, and most of the days in a week. The guidelines tell at least 5 days, but I say most of the days in the week. That keeps you really fit. That is exercise. And next is smoking. It's a number one cause for heart attacks. It's a big no for smoking. Alcohol, always in moderation. Moderation in the sense, not more than one peg, that is 60 ml. And control your sugars, control your BP, control your cholesterol. And these are the factors. These things, if you follow judiciously, you follow it really well, I think it will save you from one heart attack or a stroke. Stroke is nothing but a brain attack, and the heart, when you have a block, it's the same mechanism, but both are part of the same book. Okay.
Regarding when you're telling about the exercise, I have a small doubt, because I personally heard so many incidents like that. One will be playing vigorously like a cricket or something, and after the match, once they come, they suddenly get collapsed. And when they taken to the hospital, it will be like a heart attack. So does it have the exercise, like so many cardiovascular activity, will it affect our heart?
Recently, after the COVID scenario, we have heard that a lot of young people are dying of heart attacks, and mostly these people are very strict on their exercise patterns. We have heard our cricket star had a heart attack when he was in the gym. We had a Kannada actor who died recently in the gym. And what I suggest is that never you go for a routine cardio activity, and always before you go for a cardio activity, you have to get yourself screened at a hospital and see how much you can exercise. And then once you go for this activity, don't go for too strenuous activities. That is working in for 3 to 4 hours in a day and not getting proper rest, not getting proper sleep, and thinking about exercise and doing vigorous exercise. That's not a good way of exercise. Do what is recommended for you. An ideal 30-minute exercise, running, jogging and walking, and playing shuttle, playing. If you are into sports, really into tough sports, then you can continue that. But one fine day you do 100 push-ups, and one fine day you play in the football court. That is too much on your body.
Like after the post-COVID, the patients are getting heart attack. What is the reason behind that?
See, what we were not able to understand COVID since 2 years. Like when I used to study in my MBBS, COVID was just 2 lines in my book. So after this COVID scenario, we have come to deal with this disease really well, and we have come to understand the disease. So how the coronavirus, it enters the lungs, it goes to all the parts of the body, especially the heart, and causes inflammation there. And again, let me recollect the viewers that we talked about the coronaries, the blood carrying to the heart, the vessel that carries blood to the heart. These coronaries also get inflamed, and the blood becomes very thick. There is a chance for the blood to become clots. And this, if the blood clots in the coronary vessels, it leads to heart attack. And if it clots in the brain, it leads to stroke. If it clots in the lower limbs, we can call it acute limb ischemia. And we can find this out, which patients are prone for clots. What we do, this is usually seen after the COVID, the main disease. Once the patient recovers, we do two tests. One is known as the CRP, C-reactive protein, and another test is a D-dimer. Those patients who are having very high D-dimer values, we are supposed to give them blood thinners, and this prevents a heart attack for these patients. And many a times I have seen so many patients having very, very, very high D-dimers, but they will not be having any symptoms. Very high D-dimers have to be treated for blood thinners for quite some time.
During my childhood days, the term heart attack is I heard in elderly peoples like say 45, 50 like that. Now it's common for youngsters also. Why is it so?
Very true, ma'am. We are seeing a very young heart attacks recently. See, there are risk factors for heart attack. Like risk factors for heart attacks would be divided basically into two: modifiable and non-modifiable. Non-modifiable are age, family history. We cannot change that. Modifiable are the ones which we can change. One of the reasons for young heart attacks is that the West Asia and Southeast Asia, where we belong, like India, the Gulf countries belong, we are slowly becoming the diabetes capital of the world. The maximum number of patients in the world are belonging with diabetes are belonging to this region, and we are seeing many young diabetics also. We are also seeing a lot of young population with hypertension. The hypertension may be because of their food style, junk food, lot of salt, excessive alcohol, excessive smoking, and we also see a lot of obese people, they have less exercise, and the new generation people have less exercise, lot of job stress. Stress is also one important risk factor for myocardial infarction. All this accumulating together or cumulative will act on the body and cause an heart attack or a stroke. So that's why we see this in the younger population. And these 2 years, this is the COVID season and the post-COVID era, we are seeing more number of heart attacks. It's common for both populations, but here again, as I told you earlier, this virus, with whether it is young, old or any population, it will affect the heart vessels and cause the blood to clot. So this can happen to anyone. So that's why we are seeing this in a lot of young population.
Does our family history is having anything related to our health heart?
Definitely. The family history is more relevant in the Indian population. We, just as how we inherit the property from our ancestors, we inherit a few genes also from them. The genes of heart attack. So that is one of the reasons why we have it in the younger population also. So as we inherit these genes, we are more prone to heart attack.
So we have covered almost all queries related to the topic. In this episode, we have taken the topic coronary artery diseases. Doctor, can you please sum up the topic and give a takeaway message for our viewers?
Thank you, ma'am, for this wonderful opportunity and helping me to at least discuss about coronary artery disease. I would sum up by saying that globally, cardiovascular disease is the most common cause of death worldwide, and 80% of the people die due to a stroke or a heart attack. And we, being doctors, being cardiologists, have got to do justice to the society by counseling our youngsters, middle age group people and also the old people to follow adequate exercise patterns and adequate healthy lifestyle patterns. So we ask them to take drugs or take medications for hypertension, diabetes and high cholesterol, and always, once if you had a heart attack, it's not the end of life. You really have beautiful medications and treatment, and always stick on to your medications and stay with these medications lifelong. Keep checking your sugars, keep checking your BP, keep checking your cholesterol levels, and always visit a doctor and get advice from. Thank you.
Thank you so much, Doctor, for joining with us and answering all our queries. Today we have Dr. Julian Johnny, consultant cardiologist working in KIMS Health Hospital, Umalasam. For all cardiology needs, you can contact him at KIMS Health Hospital, Umalasam. Today we have taken the topic coronary artery disease for the discussion. I found this episode will be definitely an informative and useful episode for our viewers. Next week, same day, same time, I'll be back on KIMS Health Dr. Live with yet another doctor. Till then, it's Kripa Rajiv signing off. Take care and bye-bye.